Hi, everyone, and welcome back to That OA Thing, the podcast where we explore the latest issues, ideas, and innovations from across the Ombudsman sector. I'm Donal Galligan, Chief Executive of the Ombudsman Association. Today, we're looking at a fantastic, fascinating example of how learning from complaints can reach far beyond complaint resolution itself. We're talking about patient safety, medical education, and how the experiences of patients and families can help shape the next generation of healthcare professionals. Joining me today is Dr Tony Dysart, Senior Lead Clinician at the Parliamentary and Health Service Ombudsman. Tony, welcome to the podcast.
Thanks, Donal. Thanks for inviting me onto the podcast. It's really good to be here.
It's great to have you on. I'm really looking forward to this one in particular. I think for our listeners, let's start with the big picture. So many people might think that an ombudsman only gets involved after something has already gone wrong, investigating what happened, and hopefully putting things right where possible. But your recent work has taken learning from complaints directly into medical schools. So what inspired this initiative, and why did you feel it was important to focus on students and future clinicians?
Well, a number of things, really. I'm a GP, so I'm still working in clinical practice. We have medical students in my practice. And it always struck me that we never really involve them in those conversations when we get complaints. We never involve them in the conversations when things might not have gone according to plan and patients or relatives are angry or upset or just wanted to sort of raise concerns about the care and treatment that they receive. So that was a bit of a gap that I'd always thought existed that we've never really addressed. And then obviously working at the Ombudsman, we see lots and lots of complaints about the NHS. 80% of our workload is about the NHS. And what we've seen over time is if you dig a little bit deeper into those complaints, a lot of that is around communication. Patients feeling either that they're not heard, they're not listened to, or in some cases that they've been ignored. And that was it's a big theme that we're seeing more and more in the complaints that we receive. So much so that we've made that part of our 5-year strategy, that we've looked at how the patient voice is just being kind of missed in that clinician-patient, clinician-person relationship. I think over time we've seen that relationship change. Over the pandemic, the relationship between a clinician and the patient changed, and I think that's continued to happen. And there's been tensions there. I think it's been more fractured. The reasons are multifactorial. Patients' expectations of a service maybe sometimes aren't possible for us to meet. We see loads of things now that are on demand. We get Netflix on demand, we get movies on demand, and healthcare on demand is something that actually a lot of patients want, but clinicians just can't provide that. So there's a mismatch there, and that strains that relationship. And it's something that we've seen and picked up in the complaints that we see at the Ombudsman. So what we thought was on your strategy and a different way of working is how can we kind of move a little bit more kind of upstream, I guess. But how can we work towards try to prevent or reduce complaints from happening? And one of the things that our team thought would be a good initiative was working with medical students, medical schools, just trying to target the doctors in training before they hit the ground and become resident doctors, trying to sort of equip them with skills that they may need to have those conversations that sometimes are quite tricky. In medical school and in nursing school and other allied professionals, we get lots of training on communication, communicating bad news, talking to people about breaking news that's quite bad. And yet we don't talk to students about how to deal with complaints or with concerns when things have gone wrong or things may have gone wrong. So we thought that might be a good piece of work to do.
Yeah, it's very interesting. We will dive into a little bit more, I think, some of those points you made throughout this. I think anyone who either knows you or perhaps follows you on social media will recognize that one of the themes running through your work and your blogs is that complaints often reveal important lessons that aren't always visible through traditional clinical training, as you kind of alluded to there. I know you mentioned PHSO's new 5-year strategy and that focus on delivering impact beyond individual cases, using complaints to drive real change across the NHS and England. So could you just go into a little bit more detail about what do complaints tell us about healthcare that perhaps textbooks or classroom teaching might sometimes miss?
Yeah, that's a really good question, because I think what we see in our complaints is that human side of the story. We don't get taught that in medical school. We can study, and all the textbooks will tell us how to treat someone who's got diabetes, for example. But that human story is something that we don't see and we don't necessarily get exposed to until we kind of are on the wards and doing our clinical placement. But in terms of training, understanding what patients want, understanding what patients need is vital in terms of that kind of decision making when it comes to clinical practice. And so as part of this project, we've had 2 interns, one second year who's with us at the moment for 4 weeks, and a 5th year who was with us last month, just to come and experience what it's like to work at the Ombudsman, but mainly to experience what it's like complainant to use a service like the Ombudsman service, how they access it, what they've kind of been through before they access the service. So obviously with health complaints, there's been local resolution, which hasn't gone well because that's why they come to the Ombudsman. But, that could be 2, 3, 4 years down the line, and that kind of impact on a complainant, patient, is significant. And so we wanted people to sort of see what that feels like, and then see how we can then try and help as an Ombudsman address those concerns through various means. So they sit in and watch mediation. They sit in with our advisors to hear our clinical advice is given. They listen to phone recordings of complaints accessing the service. So a breadth of sort of experience and exposure that they wouldn't get elsewhere. And I think that's something that you can't teach from the clinical textbooks. It's a skill that the 2 that have been with us so far will have that other medical students won't have, and hopefully they'll be able to take that back into their practice, which then share with their fellow students, but also then when they move into clinical practice as resident doctors, share with their teams.
Yeah, that's really interesting, isn't it? There's so many things in life where you only see things from your own point of view, and it's not a fault on your side. It's just that you don't have the opportunity to see it from the other point of view. So that's really interesting element of that. I guess one of the things I was thinking is that unfortunately in many sectors, there's still a fear that complaints are, primarily about blame. And I must admit that at times it does sometimes feel like every few months in England, there's a report on yet another NHS scandal that, alongside those tragic losses that the report is about, also highlights the pressures that healthcare professionals face and the defensive culture quite often when complaints or concerns are raised. And yet modern complaint handling is, of course, predicated on and emphasizes learning and improvement. So this is a really unfair question in some ways, but how do we move from a culture where complaints are seen as something negative that triggers a defensive reaction to one where they're recognized as a valuable source of insight?
Yeah, I mean, I think that's a crucial question, and we all have to work towards getting an answer to. The change in that narrative around complaints is really important. So I reflect back to I've worked in the NHS now for nearly 40 years. I worked as a nurse before I went to medical school, and then I worked as a GP for nearly 20 years. When I started, the idea of getting a complaint maybe once or twice in your career was the norm, right? Now that's changed significantly. So we will see that complaints come into practices. In my GP practice, maybe a couple of weeks now, and we're a reasonably high-performing practice, but we will get more and more complaints. And I think it's trying to now move that conversation of how we respond to them as a bit of an inconvenience, as something that we just have to manage and get and deal with in this set amount of time that's set up in the regulations, to something that actually we can see as a valuable contribution to how we work, to how we practice as GPs, how we practice as nurses in a practice, how we practice as clinicians. So I think it's really important that clinically we change that narrative, and part of this project is to look at, we're working with medical students to say, don't see it as something that's a one-off event. It's something that will happen. So therefore, if it's going to happen, let's work it into your education, into your training. Let's look at how you can value that complaint as something that you can learn from, that your team can learn from. And hopefully, when we see complaints come to the Ombudsman, primarily the complainant doesn't want what happened to them to happen to somebody else. And in valuing that complaint, we can try and move to a point where we do something valuable, that makes sure that whatever happened to that complaint doesn't happen to somebody else going forward. And I think we as an organisation, the Ombudsman as an organisation, has to try and work towards encouraging that change in narrative. So encouraging trust that we may find some failings with, encouraging them to work with us to try and put that right. So either working with our stakeholder team, working with our complaint standards, or working with our clinical team to look at how they can put things right. Because we often will have meetings with trust where they are quite defensive initially, but when we talk to them about what we do as an organisation, how we want to support them in putting things right, that defensiveness goes away and they want to work with us. So I think it's a multi kind of faceted approach to how we change that conversation about complaints. We talk a little bit in the organisation about seeing them as gifts. Now that's something that doesn't always sit well with many people, but I think if we can change it to something, to a position where it does sit well, I think that's a step forward. I did a conference month with about 700 GP registrars, and so just kind of floated that idea of complaints as a gift, expecting quite a negative response. And in actual fact, it was very positively received. I think people are very willing to see that actually there's something, even if the clinical situation hasn't gone well, there's something in that complaint that might help us to learn. Either we didn't speak properly to the complainant, we were very busy and we didn't have any empathy, or its team might be lacked any compassion. There might be a variety of things that they're complaining about, but there's something in there usually that we can take away and learn from. So I think changing that narrative is crucial to moving forward, because I guess if we're going to say that we're going to see more complaints, and the organisation, the Ombudsman, the number of complaints has increased significantly over the last few years, then as clinicians who are exposed to dealing with complaints, we have to be more resilient. We have to be able to deal with them in a way that's more positive, in a way that's more kind of proactive, and in a way that's supportive of the complainants and their families. To do that, I guess, we also have to have organisations that support clinicians in doing that, because it's anxiety-provoking, it's upsetting. The fact that you might be reported to the Ombudsman might, be very, very frightening. And I think it's looking at how we support clinicians in those conversations too.
Really, really interesting and great. Just talking about that conference that you were at, grateful that you yourself can see that kind of that shift in attitude and the rest of it. It sounds like hopefully a number of different pieces are coming together at the right time.
Well, it's nice that people are asking that as well. So we're not worried. People are certainly asking us to go to these places where we're able to have that conversation with doctors who are in training. It's good that we're able to do that. We're going to hopefully, and I think we'll speak about this later on, but hopefully this sort of project will be extended to nurses and other allied professionals, not just doctors. We're focused on doctors because one of the universities had a small grant from an organisation that supports medical students. So it had to be about doctors this time, but this is almost like a proof of concept that if this works, we can then enroll the staff.
So, I mean, you have talked a little bit about the program already and what involves, but could you tell us a little bit more about the program itself and how medical students are therefore engaging with complaints, data, real life cases, as you touched on a little bit, and I guess if you could also reflect a little bit on what impact is that having on the understanding of patient safety and trust on patient-doctor relationship as well.
Yeah, so we're 2 medical schools at the moment, and we're wanting to sort of integrate the learning from complaints into the curriculum. So it's a 4, 5, 6 year curriculum, depending on the undergraduate program that you're in. And so they run this thing called a spiral curriculum. So from year 1 to 5, you're building on knowledge and experience and expertise in various subjects. And one of the things we wanted to do is introduce learning from complaints into that kind of spiral system. So it's talking about things as simple as what it feels like to get a complaint, and what do you do when that happens. What does the Ombudsman do? What is our role? That's a very basic sort of information that we want to share. And what it looks like, it will be going into the universities maybe a couple of times a year to sort of talk to students in year 1 about those sorts of very basic things. But then over the time of the course, build upon that, and so talk about the kind of vicarious trauma that can come along sometimes with dealing with complaints, or the moral injury that sometimes is accompanying situations where complaints might arise from. So, an example might be where the doctors are working in an emergency department, and the concept of corridor care is exposing them to lots and lots of moral injury, putting them in places where they didn't train to work in a corridor, or they didn't train to provide care in those environments. And it's that sort of situation that might result in a complaint. And it's trying to sort of talk to medical students to say, these are the things that will happen. What are the skills that you need to help you deal with that? When you hit the floor running, when you're a resident doctor, what do you need to equip you with the resilience to deal with that issue and deal with those sorts of concerns that might be raised? And so that's the hope, that the impact will be that there will be doctors who can do that, not just for themselves, not just to build that kind of resilience for themselves, but also for their teams. They'll be able to talk to their teams and their consultants, and they'll be able to say, we've had this experience about the Ombudsman, we know what they do. And so often many consultants won't know what the Ombudsman does. So there'll be part of the team that is actually introducing a subject that is alien to the wider team. So there's a positive there as well, that then they'll be able to talk about their experience with the Ombudsman, but also what do we do and how do we maybe approach dealing with that complaint in a slightly different way that might be more of a positive thing for the complainant, but also for the team and the trust. So I've put together a variety of resources to support the program. So we're doing panel discussions, we're doing role plays, we're role playing a situation where a patient journey is filmed going in a positive way with a positive mediation outcome, and then we do it in a less positive way. And so we play those both to students, and there's opportunities to stop us that goes along to say, okay, so I played the GP and did a terrible consultation, but what was it about that then led on to the next bit of that journey, that then led on to that complaint? And actually, when we did the mediation, what went wrong in that mediation that could have been done better, differently? And so it's providing those sorts of resources to the students to talk around and then share with their colleagues. So the impact will then hopefully be that we see fewer complaints, we see better satisfaction. We talk back to that relationship. This might go some way in repairing that relationship and making it more of a positive one, and more of a collaborative one for clinician and for the patient. I guess another thing that might come from it. Sorry, actually, I mentioned the moral injury idea, and as a result of that, we see lots of clinicians who become burnt out, who leave the profession, and again, multiple sort of reasons for that. But this may just be one part of trying to resolve that, trying to support doctors staying in the job, because we don't want to lose doctors that have just trained for 5-6 years. We want them to stay working, and if this is a way of trying to help with that resilience, then obviously we want to sort of see that rolled out as much as possible.
Yeah, that's a really good point. I know we want more than one straw taken off the camel's back, but as you say, if this can address some of that and allow people to, as you say, that's supposed to resilience to those positives, which are really difficult to kind of measure and confirm that it added to that. But I know it's still relatively early on in this, but I just wondered, have you already started to see, is there a pattern of things that surprise medical students when they're kind of exposed to those real cases? Is there any kind of themes or anything already coming out?
I think they're surprised at the journey that a person has had to get to the Ombudsman. I think they're surprised at how long things take. As a result of that, they're surprised about the impact that has. And again, I think, when a complaint comes to us, how many times has the person told that story to people along that journey? And so that compounded kind of harm, I think that's something that they've been really surprised at, and the impact that can have on a person. Our person interacts with the organisation. Our person might interact with the Ombudsman. So I think that's been a surprise to them. I think they've just generally been surprised about what we do as an organisation. I think they'd probably never heard of us, and so they've got now the opportunity to. Last week, our student met the Ombudsman. I sat in with a meeting with the Ombudsman, saw how the organisation operates. So I think that's been a real eye-opener and a real kind of it's quite innovative in a way. I don't think, well, we haven't had medical students working at the organisation before, so it's quite innovative in many ways. And I think for them, they will definitely take it away to practice. So yeah, some of the cases that we see, some of the more serious cases, I think again, I've surprised them in terms of often it's a very simple sort of failure of the system that's actually ended up letting the patient down. And it's taken them a bit by surprise as to how the system could fail in that way. So it's not an individual doctor or nurse who's done something wrong. It's actually something's happened in that pathway from primary care to secondary care that's sort of allowed a mistake to occur. So that's been a bit of an eye opener for them. And again, I think in a positive way, I guess, because they can see that systems are important in terms of supporting patients and their families, and they are part of it. The doctors and the nurses are part of that, but they have to work within a system that sometimes might not operate as well as it should.
You've already mentioned about the fact you kind of teased this a little bit, that this is perhaps a pilot and see where it goes. So that kind of like terrible interview style question of what would success look like if this kind of complaint-led learning became more widely embedded over the next 5 years? And if you do know what that looks like, I guess the follow-on question is, what can other ombudsman schemes and other sectors learn from this kind of approach?
I think what we are hoping for is that with our engagement with the regulators, with the GMC, primarily on this project, is that they will help us with the rollout of the scheme. So they will endorse it and they will help us to look at ways of integrating this into medical education. So the GMC can support this, then that's one way of getting this embedded within the curriculum. And once it's embedded in the curriculum, then it becomes part of what medical students have to learn. So in September, there's a conference showcasing the work that we're doing. And I think you've shared the link in your bulletin. But we're going to use that as a bit of a springboard, really, for other organisations, other medical schools that will be present as delegates to look at what we've done, and hopefully that'll spread out to their medical schools. And so therefore, it will spread that way. I think in terms of other ombudsmen and using this as an example of what we can do to try and help learn from complaints, I think it's trying to spot those opportunities, trying to spot those gaps or spaces that might exist. So I guess whichever sector you're from, there's people there who are maybe going to be junior or just new to the ombudsman and new to organisations who might just need that kind of encouragement to engage with what that relevant ombudsman does. So I think it's that curiosity, that kind of looking at what your organisation does. So we obviously deal with health. We need to look at how we can help clinicians working in health deal with complaints and support that change in narrative that I mentioned earlier on. So I suppose in our government departments, it's more difficult, but I guess it's trying to role model what we're doing with education, with medical education in other sectors. So across the civil service, what other parts of an organisation can engage with this kind of training, this kind of learning? We will probably have some work to do with our stakeholder team if there's a lot of interest. But I think it's a difficult one to know, because my experience with other ombudsmen is limited. But I guess for us, there was an opportunity to look at things slightly differently and look at whether, let's not just look at a complaint that's 3 years old and already the time has passed and the horse has bolted, essentially. Let's try and take a step backwards and look at what we can do to try and get in there before the horse bolts.
Yeah, it's really, really interesting. And I'm really keen as well to make sure we re-engage with you whenever it is 12 months down the line or longer than that, to see has that impact been, and also how you're able to measure those things. Those things that we're talking about, we really do think this will make a difference, hopefully, to medical professionals' lives as well. And it's always that tricky thing about that. How do you measure it? It's going to be really interesting to see.
One of my research team is working with Chester to look at the third-year medical student and do a small kind of research project to say, what's your exposure, knowledge, ideas of them now, and we'll do that third, fourth, fifth year. So that spiral idea of training we might see some impact there. So I think it is watch this space, but absolutely we'll be able to feed this back and look at how successful it's been, hopefully, but look at what we've learned from things that we could have done differently, better, or just the same.
Well, look, Tony, thank you so much for joining us and for sharing your insights. It's been a fascinating discussion, and I think a really timely reminder that complaints don't just tell us what went wrong, that they can help us understand how services can improve, how trust can be strengthened, as you've mentioned, and how future professionals can learn from the experiences of the people they serve. So thank you, Tony, for joining us.
Well, thank you for giving us this opportunity. Really appreciate it.
And to our listeners, look, if you'd like to learn more about the Parliamentary and Health Service Ombudsman's work, do take a look at the links in your podcast description below, including PHSO's upcoming conference in September that Tony just mentioned there. You can stay connected with the OA on LinkedIn, X, and Instagram. Don't forget to subscribe to that OA thing on Spotify and YouTube so you never miss an episode. Thanks for listening, everyone, and hopefully you'll join us again next time.
Thank you.